Hello everyone, my name is Lauren Finaldi and I'm here to talk to you today about the PCA Alaris pumps and Alaris regular medication pump. The last time that we met in a face-to-face class, we spoke about IV medication management via no technology, which is a lot different from this. If you remember, we had to talk about administering IV medication, specifically an antibiotic, to a patient that was septic. We needed to calculate the drip factor, and we also needed to calculate how many drops were going into the chamber per minute to ensure that the antibiotic was being administered safely. So in this module, our flipped classroom, we're going to be talking about the Alaris pump. I'm going to be going over a high-risk medication that we spoke about, which is heparin. Obviously, if you administer heparin too quickly or too slowly, there can be a lot of repercussions. That's why Alaris has developed a pump with something called guardrails, and we'll go into detail more about that as we go through the pump. So, in order to start infusing a medication, the pump has to be turned on, which it is. You would just press system on. You would then press channel select. This is called a channel also, and this is called a brain. The brain is where all of the medications are kept in the guardrails. So I would press channel select, and it would select channel A. This is channel A. I would then go to guardrail drugs, and in this case our doctor has ordered heparin. As you can see here, there is a keypad with A through Z. So I will click F through J, and then I'll click H for heparin. And as you can see on the top, in alphabetical order, there is heparin. It then asks you to confirm that you have chosen the right drug. It says heparin 25,000 unit and 250 mLs was selected. Is this the correct drug? I would then click yes. And then it also has a second safety feature which asks if a second nurse is there to verify. As this is a could do a lot of damage. It then tells you to confirm once again if this is the correct drug and the amount of the drug. Is it really 250 milliliters? And is this really 25,000 units of the drug? You then press next. Now, each hospital has its own policy in regards to heparin nomograms. There's a cardiology nomogram, and there's also a thromboembolic nomogram. In this instance, we don't need to calculate the drug dosage because we're going to assume that based on the nomogram that we're using and the patient's weight in kilograms, that we need to administer 1,200 units per hour of the drug. And we know that there's 250 milliliters in the bag. And then we will press start. As you can see here, it tells us the volume to be infused, VTBI means volume to be infused, and it's 250 milliliters. Here, on this side, it also says 1,200 units per hour, which is great, and this means 12 milliliters per hour. So when the nurse is walking by, you can, at a quick glance, you know that heparin is running, and that this is a high alert drug. Now, say 6 hours from now, we have to redraw our blood work, as we do for the heparin nomograms, to ensure that the patient is within a therapeutic level. Say when the level comes back, it's not therapeutic, and we need to increase the rate of the infusion. We would go to channel select, and of course we would also bring a second nurse. We would go to channel select, and say we needed to increase it by 300 units per hour. This would increase the dose to 1,500 units per hour. But say in this case, the call bells are going off and there's a lot going on around the unit and your mind is, not focused on what you're doing as that may happen. So instead, you put in 30,000 units of heparin per hour and press start. an alert comes up and it says press reprogram. The dose is exceeding the hard limit of 4,000 units per hour. This is a guardrail. This is a safety feature. The pump is telling us that this is too much medication to administer and you can do harm to the patient. So at that point, you would press reprogram and put in the appropriate dose with the second nurse to verify. So it will be 15 milliliters per hour and a total of 1,500 units per hour, and press start. Okay, so now that we're administering that safely, we can move on to the second portion, which is about PCA management, patient-controlled analgesia, which we use for people who are in pain, that are learn-oriented ×3, that would like to have their pain managed better. So I'll show you this. This is the medication pump administered. The patient will hold this in their hand, and when they feel that they need pain medication or that they're not feeling well, they can press this button and it will be infused through their IV or their PICC or their port to properly manage their pain. So we'll give this back to our patient. Okay, so if I'm going to program a PCA pump, I would also do the same thing. I would press channel select, and it gives you 4 options to choose from for pain medications: Dilaudid, fentanyl, methadone, and morphine. In this instance, we'll use Dilaudid. It then proceeds to ask you opioid naive or opioid tolerant. Let's just say that this is an oncology patient that has had chronic pain for 2 years and has used Dilaudid before, so we will pick opioid tolerant. And we're using, in this syringe right here, we're using the 25 milligram and 50 ml syringe. And then it asks you again, is this correct? And you would press yes. And it also says, do you have a second nurse to verify? You would press confirm. Now, it already tells you the drug amount and the volume, which we already know. You would press next. And in this instance, based on the doctor's order, of course, in this instance we're going to use PCA dose and continuous dose. The PCA dose we'll choose as 1 milligram as ordered by the doctor every 15 minutes with a continuous dose of 0.5 milligrams per hour. And based on all of these calculations, it should equal a total per hour of 4.5 milligrams per hour if the patient presses the button every 15 minutes to receive pain medication. At this point, we would press confirm, and it asked me to lock the door. Unfortunately, I'm not able to lock the door and administer this medication, but once I would press confirm and lock the door, it would begin infusing automatically pain medication to my patient. And the patient can also press the button to receive medication. So as you can see, all of these features are in place for the patient to keep them safe and are especially important when using high alert medications that could have very bad repercussions if administered incorrectly. At this moment, I'll take you over to a booklet that I have here that also talks about the PCA management. In this model right here, it talks about the pump. This is very important to review with the end of the nurse at each shift. At the end of each shift, you'll see the total amount of drug that is administered, total demands, which means how many times the patient has actually pressed the button and received the medication, and delivered will tell you how many milligrams the patient has received. This is important in making sure that the proper amount of medication has been administered and the patient is safe and comfortable. This will help the doctor decide if we need to change any of the orders for the patient. So in regards to that, that's the lesson on how to use an Alaris PCA pump and how to manage medications using these pumps. For the next course, we'll be meeting on, I believe, Adobe Connect and discussing how Alaris has an interface now in which when you scan the medication and scan the patient, it will also be hooked up to the patient's EMR. this is exciting in that we won't need to, as a nurse, need to enter in any numbers, and there'll be less risk for error. So to be continued.